Hello again, I'm Doug Smith. This is another edition of Portsmouth This Week, the voice of Portsmouth Town Hall. My guests today are Ray Davis, the coordinator for the Portsmouth Prevention Coalition, and Marianne Ramo, the chairman of the coalition. Welcome both of you back to the show.
Thank you.
Ray, several weeks ago you briefed the town council on the second annual drug survey that was conducted among our school kids here in Portsmouth. And we discussed the first one last May, it seemed like just yesterday, and the results seemed quite disturbing. How do we do in this year's survey, and what did it show?
Just to clarify, that survey is called a community needs assessment. We surveyed all the Portsmouth public high school students from grades 7 through 12 for the last 2 years, each year. We also do focus groups with groups of students in the grade levels, with parents at the middle and high school, as well as community leaders, and we take into account some community factors as well. So this is not just about the students' use, this is about the community as a whole as well. But it focuses on adolescent substance abuse use. The survey is certified by the federal government, Drug-Free Communities and Substance Abuse and Mental Health Services Association, our agency rather, because we look at several things that they require. So we look at perception of harm and risk that students may have, perception of parental disapproval of that, as well as their peers and their use of tobacco, alcohol, marijuana, and any other drugs.
So could you tell, are we making any progress here in Portsmouth?
Yes, we are making progress. Change takes, the philosophy is that change takes 5 years to really make huge differences. If you can make a 2 to 3% difference in 5 years, you're doing very well. We have 2 years of evidence, and quite frankly, it's very much the same for both years. We have some trends that we've discovered that we'll talk about a little bit later, but we're doing about the same that we've done for the last couple of years.
One of the major positive things is that now the public is aware of this stuff, I would hope, and you know, can go to see this data and take a look at it, see how it impacts in their own kids' life. How many kids took the survey this year?
The total number was 994 this year. The previous year it was 1,230 some. Big difference. We had a discussion with the school department about those differences, and we are making sure that that does not repeat itself when we do the survey again.
Okay, do we have any idea what is the total student population here in Portsmouth?
I don't have the exact number. I know that when we did the survey 2 years ago, we had almost like a 95% return. We have very high percent, and this is pretty high as well, but we know there were some gaps in that. We know how that happened. It was a situation that can be corrected and will be corrected, because we want these accurate figures are what drives what we need to do and what the community needs to know about.
Yeah. One of the things that impressed me, or scared me, I guess, was the age at which kids are starting to use this stuff. What did the current survey show? I'm sure it's similar to last year's, I would guess.
It is disturbing, and it's this is and I'm not saying this to sugarcoat anything. This is a national trend as well, but we're noticing that it's younger and younger ages, especially around the issues of prescription drug abuse, and that's someone using a prescription drug that's not been prescribed by a doctor, getting it from someone's medicine cabinet, or some friend giving it to them and not really knowing what it is. That's getting to be younger and younger.
Yeah.
And that's an alarming trend.
But that's also something we can do something about, and you guys are doing this drug, you know, for people to take a look at their medicine cabinets and get rid of old drugs in a proper way. You want to mention that?
And this is very timely, because tomorrow is the National Drug Take-Back Day. The Portsmouth Police Department have been great partners with this initiative. It's from the Federal Drug Enforcement DEA agency in cooperation with all the local police departments.
And when we say tomorrow, We mean Saturday,
Saturday,
September
sorry.
27th,
That's-
depending on when this is filmed.
That's true.
Sorry
I
about
just
that.
wanted to clarify that.
But I think the other thing of interest is I believe they have a drop-off anytime in the police station.
Well, Portsmouth was the first police department in the state to institute 24-hour, 7-day-a-week take-back. There were so many drugs given to them that they couldn't get rid of them all. And there's a procedure that they have to follow, and there is no state facility to dispose of those. So the police department had to stop doing a take-back because they were inundated.
Wow.
There are some things that should be revealed this week from the DEA around where police departments are going to be able to do that so they can reinstitute it. But Saturday from 10 to 4, you can bring prescription drugs to the Portsmouth Police Department. They will make sure they're disposed of. No hypodermic needles and no illegal drugs.
Unfortunately, a lot of people will see this next week, so that may not help. But the idea, though, of going through your medicine cabinets, pulling this stuff off, and even if you have to wait, put it somewhere where you can keep it safe and wait until you see somebody say, okay, we can take all the meds and bring it down.
Well, and the other thing that's recommended for if you have kids in the house is to get a lock box to
Yeah.
put your prescriptions
That
in.
seems really bizarre, but I think you're absolutely right. You kind of have to do that with liquor probably too in some cases.
Right, which I think more people probably do it with their liquor cabinet than they do with their with their prescription drugs.
Yeah,
They
that's-
probably
that's
don't
true.
think about it.
I
so.
used to work with a lieutenant from the Providence Police Department who was the head of the gang unit. And he said, I have 2 things that parents could do that would help the drug and alcohol problem. Lock your liquor cabinet and lock your medicine cabinet.
Yeah.
Because oftentimes we'll find young people, guests will come into someone's home and go in and rifle through a medicine cabinet. So it's good safety.
Yeah.
It's just a precaution.
Very good point. I think if people want to take a look at the findings here, your survey broke down the grade levels and when people started, the percentage, et cetera, et cetera. But I think the key thing of all this, are we making any inroads into changing people's perceptions about this?
Yes.
Is that a problem? Is the perception of, well, marijuana's okay, a little bit of alcohol's okay, blah, blah, are those perceptions still there? I mean, do people understand the danger here?
Yes and no. Sounds like a political answer. There are dangers there. As the science increases, we're dealing, let's talk about marijuana briefly. The marijuana that is available today in Portsmouth, Rhode Island is nothing like the marijuana that was available in the late 60s.
You're talking the medical marijuana?
I'm talking the marijuana, period,
Okay.
that's available. And what I mean by that is the THC content, and the THC is the drug that produces the effect of smoking
Right.
Marijuana. It's been engineered for various purposes. Some of those are very legitimate for medical purposes for chemotherapy patients. The THC content is extremely high. The effect of the drug is more intense that way, and that's not necessarily a good thing. And that marijuana is so much more potent than what used to be available. I think there's a misunderstanding. There may be parents who had experimented with it in their youth saying, well, it didn't really hurt me. We're talking about a different animal now, and we're talking about adolescents. We're talking about children. We're not talking about adults, and there's a big difference. Same with alcohol. The greatest example of alcohol is we're not talking about some adults having a cocktail after work. Adolescents don't drink like that. It's binge drinking. And it's the effect of drugs and alcohol on the development of a young person. Has an effect. Anytime you put a drug into someone,
Yeah.
there's going to be an effect.
Well, I know that and you know that because I've read some of the material you sent me. I guess the question is, do the kids know this? See, some of the stuff you sent me was very scary, I thought. And I thought if I was a kid and I looked at this thing, would it have an impact? And some of the stuff, if you could put it into words that I understood, particularly for adolescents, as you say, 14 to 21, I don't know what the age, somewhere in that time frame, there are major developmental problems that can come out of using this stuff. And that would, the idea that you're going to lose 10% of your of your intellectual capability, if you do this stuff, would scare the heck out of me. But do you get a sense that the students, the kids, think this?
Well, I think that we are working on that. You know, that's one of the goals, I think, of the school department and the Prevention Coalition, is to get that information out to the kids. I think when we had John Underwood, the Life of an Athlete person, come in last year, he had scientific data that, you know, really talked about how these things affect your body and your performance. I think they are changing the health curriculum at the high school, so they're going to have more drug and alcohol prevention information to get that out there and to give the kids ways to say no without just say no. You know, like just a way to feel good about the choices that they're making.
Now, what's interesting though is, so we got two groups here that are really key: the kids themselves and the parents. What are the parents? How do you get a sense of the parents are feeling about this stuff?
I think many parents are frightened, and rightfully so, because we're dealing with substances that they are not familiar with, and it is kind of a frightening thing to get into. I don't think parents have all the information. They're not aware of, you know, some of the things about the THC content in marijuana, about the availability of it in Portsmouth due to certain conditions that we looked at as well. And the fact that, and this is the most disturbing thing, and one of the reasons why we look at perception, we ask kids, what are the consequences, what are the risks of smoking marijuana? They said, what are you talking about?
What risk?
What risk? You know, it's medicine. No one has ever died from an overdose of it. The state of Rhode Island is considering legalization of it. It's been decriminalized. What are you talking about?
Yeah.
And some of them think it's legal. They
Right.
think the decriminalization actually meant that it was legal, and you know, because the medical marijuana is legal. They don't always understand that it's not.
And I think this is a good point, that it is illegal for anyone under 18 to possess marijuana, but those are serious enough. But it's what can happen to someone who does use these things on a continual basis. It's, you know, smoking marijuana is not as, and we had this conversation off camera beforehand, it's not as addictive as alcohol is. It is addictive. It's a proven fact.
Sure.
The younger, and it's the same with alcohol, the younger a child starts to experiment with drugs and alcohol, the greater the propensity is that they will develop problems later on. That's a fact. That's not a scare tactic. And one of the things that, and I want to say thank you to the Portsmouth School Department, because they really have gotten behind the information that we've brought out and trying to make some significant changes in the educational system and the climate at Portsmouth High School. And my hat is off to them for that.
Yeah.
As Marianne just said, they're overhauling the entire health curriculum to concentrate more on the specific substance abuse issues that are there now, and the Life of the Athlete program, Project Purple, because the other side of this coin, as you said, is that most of our kids don't use this stuff. And for those kids who have the courage to say, you know what, I'm not going to do this, they need to be acknowledged for what they do. And most of our kids are making good decisions.
Yeah, that's the positive side of this whole thing.
Right.
We'll get back to that, I think, at the end here.
And there's also the chemical health policy that they've enacted,
Yes.
that they're working on. I mean, I think it's a process. You know, I don't think we're going to have instantaneous change. You know, for me, I'd like to see things, you know, happen yesterday.
Wouldn't we all?
I know. So
No, that's
have
true.
patience and just keep, you know, a little at a time.
Yeah, I think it's a matter of chipping away at the perceptions of this. You know, unfortunately, in movies and every place else, all this kind of drug hippie culture, sorry, Ray, you know, comes up as really a great thing to do. It's really cool back then. Everybody was high. It's not like that, guys. Your life's not like that. And if you want to take a chance on screwing up your mental capacity to do stuff, I guess what bothers me, people say, geez, I came out okay, and I was but how do you know what you might have done if you didn't start that, which is kind of, you know, hard thing to judge.
But the other side of that is that it is proven that long-term use of marijuana has an effect on short-term memory.
Yeah.
It has an effect.
Exactly.
It's like anything else. It's going to have a cause and effect. I think the good thing about the discussion with adolescents is that, first of all, not everyone is high. There are lots of, pilots, teachers, musicians who do not involve themselves in these things because it affects your performance. And that's the beauty of life of an athlete. It's not just talking about don't do this. It's like you want to be the best football player, you want to be the best bass player, you want to be the best student. You'll be the best at those things if you do some of these things to take care of yourself.
Yeah.
And doing drugs and alcohol is not one of those things.
Well, the scary thing that I saw was that this graph showed a 10% loss in terms of scores on a college entrance exam for people that could persistently use pot or and other things. Right. That would scare the heck out of me because that 10% could mean the difference between going to a school that you want and going to somewhere else, or not going.
And it's the same with the results, that study that came out that showed that people's IQ, the people that studied for 20 years, that started using at 14 and used regularly for 20 years, the IQ went down by, was it 10 points?
There's for those people, young people who use a lot of marijuana and consistently, there's an 8% drop in the IQ.
Yeah.
And that's a proven fact.
I can't afford that.
Now that's like 1 out of 6. 1 out of 6 users who are heavy users, but that's a significant amount.
Yeah. Let's get off this topic for a minute because we could talk about this all day, but I want to hear something about the PPC, the Portsmouth Prevention Coalition, and what you guys do and how you plan to attack this problem. How you got formed, maybe, how you started.
Well, the Rhode Island is very unique. I think it was like 1987, there was the Bramley Act, which created the Rhode Island Substance Abuse Prevention Act. And it was money set aside to form a prevention coalition, they called them task forces then, in every community in Rhode Island. And it was funded back then by municipal fine, or speeding fines, traffic fines. That's all changed over the years. But that's how we got created. So we're under the state legislation. We're part of each town, each community in Rhode Island. That's changed over the years. I'm a resident of Portsmouth and have been on the coalition for a number of years. I'm a prevention specialist. I used to work for Kodak and Caritas, but I've lived here too. The position now is 20 hours a week. That's my paid position. It's part-time, and there are no benefits, and that's been increased. When I started 3 years ago almost, it was 4 hours a week.
Yeah.
Every town in Rhode Island does it differently. Our coalition, I'm the only paid person. Everybody else is a volunteer on this.
Yeah, I was going to say, Mary Ann, whatever he's making is more than you're making, right?
That's okay.
As the chairperson.
With Ray, it was 10. It was 4. Like you said, it was 4 hours. That was before I came, and then it was 10 hours a week, and we've been able to get it up to 20 hours a week. Ray puts in much more time, than so we've worked really hard.
Well, he probably spends more time than that emailing me,
Exactly, or the conversations that we have, and he puts in the most amount of time. And the Portsmouth Prevention Coalition is a group of all different parts of the community. We have parents, we have school employees, we have someone from Roger Williams University, we have somebody from Boys Town that comes.
How about the Abbey? Do you have anybody from Portsmouth Abbey?
No, we do not. Portsmouth Abbey used to be involved with us in some of the anti-smoking things, primarily when Bunny Miller was the past chairperson for 17 years, and I know she's watching this, so hi Bunny, and thank you. But I've reached out to them, and we really haven't had much response, quite frankly, from them.
That's too bad. They probably have a lot of resources that could be well put to use here.
This is a great invitation to them. I'd love to have Portsmouth Abbey.
Yeah, because I'm sure they have the same problems. They're, like you say, it's a national issue. It's not it's a social problem, and it's not just us. But that'd be good. What about how do you relate to the other towns?
Well, I just want to say one more thing about the coalition. The reason we have this coalition is because it's been proven that the way to solve these substance abuse problems is usually not because some edict comes from Washington, D.C. or Providence, Rhode Island. It comes out of this community. And we've got a really good, strong coalition that's open to any citizen in Portsmouth or anyone who works for an agency that has to do with adolescents and these subjects. As Mary Ann had said, we've got school social workers, school administration, the police department is an active participant in this, as well as the faith community. We just had a brand new person join our group who works with the military spouses here in Newport County, which is a big thing. We've got 22% of our kids identify themselves as military kids, and they have special circumstances that influence them, and they're part of our community.
Yeah.
And so I'm very proud of the group that we have.
And we meet the fourth Wednesday of every month at 8:30 at the town hall in the conference room upstairs, and the public is welcome, so if anyone wants to come.
Okay, say that day again.
So it's the fourth Wednesday of the month,
Okay.
and it's at 8:30 in the morning
Okay.
at the town hall upstairs in the conference room.
Yep.
And the meetings are about 2 hours long, which is long enough.
Mm-hmm.
Yeah. But there's a lot to talk about.
There is a lot.
We try to keep it short as we can, but.
Yeah. Now, you mentioned briefly funding. How are you guys funded now, and how's the funding working out?
You're the accountant.
Okay.
You can do this.
So we get a portion of our funding from the state of Rhode Island. We get a portion of our funding from the town. A portion of our funding comes from the school. We've received some legislative grants recently, and also some private donations. And a big portion of our revenue goes to support the student assistance counselor at the high school. We get, for instance, we get $19,196 from the state, and $19,000 of it goes to support the student assistance counselor, because that was a position that years ago the Prevention Coalition had decided that they didn't want to lose that position, and the school wasn't going to fund
Now, do we
it.
have one of those in the middle school as well?
No.
But we
do.
could use one.
We could definitely use one at the middle school as well.
And the other things that we spend our funds on are, of course, our coordinator stipend, the pennies that we give him. You know, we have some membership dues that we have, a couple of those. We do professional development for our members of the coalition, some office supplies, a little bit of mileage. It's a tight budget. You know, we are looking for additional funding this year.
Always.
This year, yes.
And I think it's important to point out that the funding that we receive from the state of Rhode Island, $19,196, not one penny of that is state money. That is all federal block grant money now.
Well, as you say, we're very different and unique here in Rhode Island.
We certainly are. But on the other hand, we just received a $5,000 legislative grant from Representative Canario this week, and that's much appreciated, because that will help us be able to do some of the work that we've done.
Yeah, I think a lot of these conferences are important for you guys to go to be able to learn more about what's working and, you know, just educational stuff.
And we did, I didn't mention that we did apply for the DFC grant, which is a drug-free community grant.
I was going to mention that, because that's okay. That's a key one.
That's would have been $125,000 a year to the coalition for 5 years.
Wow.
We did not. We just found out last week that we did not get that. We will apply again next year, and we're hopeful. But so that changes our financial picture for this year.
Yeah,
so
I would
we'll
think
be,
so.
We'll be knocking on doors.
But you know, we're lucky in that we have a great working relationship with Tiverton, Rhode Island, and Middletown. Both of those communities have drug-free community grants, and Tiverton has been extremely gracious and helpful in working together. We've done a number of things. We've done programming with all the faith communities in Little Compton, Portsmouth, and Tiverton, the bus drivers for all of our public school kids, for all those three as well. We've reached out to all the alcohol Class A vendors in all those three communities together. And now we're going to be doing some things with students together who have made healthy choices as well.
Yeah. You guys think you're getting adequate support from the town, the schools, and the police department here locally? It sounds like they're big supporters. So.
You know, we have had, I would never have been able to apply for that grant had it not been for the Portsmouth School Department. They paid an additional amount for me to be able to take the time to write that DFC grant, which was huge. They have been big supporters for us in the past, and we're certainly looking for Superintendent Riley to continue that tradition.
Which I think she will.
I think she will too. We've been very encouraged by that. The school department, the town just stepped up a little bit more too. And the police department has always been cooperative. We're lucky. We have a good relationship here in Portsmouth with those three key players. We need more work with the students, and we need more parents involved. And part of our job is to help be able to give parents information to be able to have those conversations.
Yeah. I was going to bring this up at the end, but that segues nicely into this whole issue about volunteers and people. Have you considered trying to get students to volunteer to be on the coalition?
We have. We will be doing things that are geared for students, but I'm going to be quite frank with you because you've sat through these. I'm not going to ask a student to sit through 2 hours of those meetings, but that's not negating the fact that we definitely want students' input, and we had a subcommittee through the school committee that had students on it who gave us great tips, and we are going to pursue that again this year as well.
Because I know you're going to try to form a couple of sort of topical subcommittees.
Yes.
You know, media being one of them, right? And the thing is, I would just think some of that young talent who knows how to do a Facebook page and stuff would be a big help. But people can contact you to connect up, to figure out what you guys need and try to help out.
Right. We're going to put on a series of information for parents as well. I want to say one thing you just mentioned. I just got off the phone this morning with Dr. Renee Hobbs, who is the director of the communications department at the University of Rhode Island. So she's a social media expert. She has asked me to come to a meeting in 2 weeks. URI and her program is getting ready to come out with a whole new program for high school students, and she wants to be able to do some things with us here in Portsmouth. So I'm going to take full advantage of that and go to that meeting with her, and I'll be able to report back on that. And that was at your suggestion. I appreciate that.
Sounds good. We're almost out of time. I told you we would be. But before we leave, the Chris Herron project, Project Purple, how did that go? Is it continuing?
Yes, so Project Purple, the town went purple last year, the last week of January, and it went really well. We had people that decided to do it, you know, that it wasn't even things that we had put into effect. I mean, we had the town hall purple, we had the police station, we had the library, we had the fire
department. And that's really
department.
to show support for the kids that are making the right decision.
It is, and we'll do that again this year, January 26th through January 30th. So if anybody wants to show their support, you could put purple lights, purple ribbon, just to show that you support
Good idea,
this
and
cause.
somebody needs to remind me on this program to talk about it a couple weeks ahead of time. The second one was this Life of an Athlete program, which sounds very interesting. You get 10 seconds.
So the Life of an Athlete, we had several students that went and coaches, and they're putting that into effect right now, and it's called Patriot Committed, and it's really the kid-driven, student-driven, and they have a lot of enthusiasm.
That's super.
It's exciting.
They're giving a full report to the school committee on Monday night, and they have a video that you're going to get so you can display it as well.
Sounds good. Guys, we're out of time. I'd like you guys to come back sometime in the future and talk some more about this stuff. In the meantime, it's Doug Smith signing off. We'll see you in the next edition of Portsmouth This Week. Thank you.